Hi everyone, my name is Kelsey Sapieha, and I did my practicum with the Environmental Public Health Sciences Unit at the Government of Alberta. My culminating report was entitled Food Systems, Climate Change, and Environmental Public Health, Implications for Alberta. And I'm excited to share some of my key takeaways with you here today. Before we get started, I would like to acknowledge that I completed my work on the traditional lands of the Nahia, Dene, Anishinaabe, Nakota Iska, Niitsitapi, and many Métis peoples whose connection to this land has been since time immemorial. My primary outcome of interest was food security in Alberta. Food security is when all people at all times have physical and economic access to safe, sufficient, and nutritious food to meet their dietary needs and food preferences for an active and healthy life. However, the effect of climate change on food security in the lens of environmental health is mediated through its effect on food systems. So I narrowed the scope of my report by focusing on this really overlap here between three concepts or fields: climate change, environmental health, and food systems. To quickly get us on the same page, some working terms of each. Climate change is the anthropogenic long-term shift in temperatures and weather patterns. Environmental public health is the specific sector of public health that is focused on the ways that environment impacts health, including the air, water, soil, and living ecosystems. And food systems are all the processes involved in feeding a population, which goes from production, harvesting, transportation, all the way to processing, storage, marketing, and consumption. I focused on food systems and topics within the scope of environmental public health. So there are definitely food security determinants that are influenced by climate change, such as income, migration, and safe housing, that are incredibly important, but they're outside of the scope of this report. And all of this takes place within an Albertan context. So the key themes that I identified and I'm going to be talking about today are ones that are pertinent to Alberta. This report was initially conceptualized as a literature review of a single database. I was quickly persuaded out of that approach in discussion with my supervisors because of where environmental public health sits. It sits at this bridge between environmental sciences and health, and a single database or set of search terms wasn't going to capture the right information to summarize what I was looking for. Therefore, I completed a narrative review that identified important literature and key themes using the support of my supervisor, as well as notable international and governmental reports. The purposes of this report were to provide insight and summaries of the literature into the state of food security in Alberta, suggest how climate change will influence food systems for Albertans in the future, and detail how environmental public health can contribute to improving food systems by promoting resilient food systems in Alberta. There's four main ways that climate change is going to affect food systems through environmental public health. The first of those is extreme climate events. There's the likelihood of increased frequency and intensity of drought events in Alberta, which is going to lead to reduced crop yields, reduced livestock health and productivity, increased water demands, and increased soil erosion. There's also going to be an increase in the frequency and intensity of wildfires, leading to decreased crop yields through the burning of arable lands and crops, decreased livestock health and productivity, increased water demands, increased contaminants in the food systems, and decreased access and availability of food getting to markets and people getting their food. The last way through extreme climate events is extreme temperatures, both hot and cold, that are likely to increase in the face of climate change. These extreme temperatures will decrease crop yields, decrease livestock health and productivity, decrease access, and increase breaks in the cold chain, which compromises food safety. Anytime there's decreased access, it's more likely to affect people that are already vulnerable and already are experiencing food insecurity, such as elderly or those with comorbid health conditions. The second main way that environmental health is going to see the effects of climate change on food systems is through increased contaminants in the food systems. Biological contaminants, such as pests and microbes, favor a warming climate, as well as precipitation changes. Furthermore, as the temperatures increase, there's going to be a northward shift in the range of pests and microbes. So new pests and microbes that were not previously a concern in Alberta may migrate into Alberta as the temperature warms. As well, there's currently seasonal trends of increased pathogens and infections in food in Alberta and Canada, such as E. coli and Salmonella during summer months. So an extended warm season is predicted to increase these infestations. Chemical contamination is also expected to increase under climate change, with increasing levels of mercury and lead in fish. and increasing concentrations of polycyclic aromatic hydrocarbons and persistent organic pesticides in crops, water supplies, and livestock. Compromised food safety can alter consumption due to the real or perceived risk of consuming these foods, as well as reduce the availability of foods if outbreaks occur in commercial or community settings. A really interesting way I found that climate change is going to impact food systems is through altering the nutritional content of food. This is a graph from Myers et al., and it shows that grains and legumes grown in increased atmospheric carbon in general have a decreased amount of zinc, protein, and iron, which means that even though you may have been consuming a diet that adequately met these micronutritional and macronutritional needs before, eating the same diet in the future might lead to nutritional deficiencies. Lastly, climate change is going to affect traditional food harvests. Traditional foods are plants, berries, large and small mammals, fish and birds that are acquired through hunting, fishing, and gathering activities. Substance consumers are people that consume these foods and are required to consume these foods to meet their nutritional needs. And as we experience changes in temperatures and precipitation and extreme climate events such as those wildfires, droughts, and extreme hot and cold days, we may see a shift in the location that these animals, plants, and berries are found in, or the quantities that they're found in. These subsistence consumers are people that are already more likely to be at risk for food security. And in this group, climate change is a threat multiplier that will significantly increase their risk for more severe food security or pushing people that were food secure into food insecurity. In light of these predicted threats to food systems, environmental public health is uniquely positioned to mitigate the effects of climate change on food systems and its outcomes for Albertans, as they have specialized knowledge in both environmental science and public health. The ways that environmental public health can, specifically, but really all of public health, can contribute to the development of resilient food systems is number one, through monitoring. Monitoring climate variables, contaminants, and identifying emerging risks, as well as translating this data into usable information, will be a key role. Number two, advising. Environmental public health should provide timely, accurate, and accessible advice for decision makers and the public. This can be done through strengthening existing communication channels, as well as developing new methods of communication to transfer information to both the public and policy decision makers. Number three, advocating. Environmental public health can support policies that are outside the domain of health that encourage food resilient systems, such as encouraging local food production, as well as advocating for policies and practices that mitigate the effects of climate change. As well, they can promote safety net programs such as healthy food boxes and assist them in delivering safe and healthy food, as well as advocating ceaselessly for evidence-based policy that is both responsive and sustainable. Fourth, we can contribute to intersectoral collaboration. Strengthening existing relationships between governmental ministries is going to be key, as this is a problem that's going to require multiple levels of expertise. Building Indigenous partnerships is going to be a really key movement into developing resilient food systems, as Indigenous knowledge to develop local food systems will be very important in developing resilient food systems, as well as encouraging collaborations between all levels of government and supporting community initiatives. There are several gaps in this research that I completed. Food systems are really complex. Broad outcomes such as food insecurity are really hard to nail down to attribute to specific events or localities. And Alberta-specific literature is actually quite scarce. Any projections that are there are based on modeling and are therefore open to imprecision. There's also the lack of provincial strategy or framework within Alberta for any of these problems, for climate change, for food systems, or for food security. Lastly, the effects of climate change on food security is mediated through this impact on food systems. It's not a direct outcome on food security. So there's significant research based primarily on the effects of climate change on aspects of the food system, such as crop yields, but the complexity of food systems makes looking at food security outcomes from these climate change events really difficult to find out the exact pathway. So there's definitely a research gap between the two. There's assumption in a lot of the literature that these effects on food systems will impact food security, but how this manifests in individuals, households, or populations does require better research. So my two main points from today is that climate change is going to add new threats and multiply existing threats, both locally and globally, to food systems, which will affect food security. And environmental public health is uniquely positioned to contribute to the programs that mitigate the effects of climate change on food security in Alberta. I'd love to say thank you to Ruth and Mary, who are my supervisors. I think I saw Ruth at least on this morning. I don't know, Mary might have dropped in, and the entire EPHS team, as well as Kathy and Jaime and Jeff for being my second reader.